My name is Dr. Mindy Bixby. I'm a movement disorder specialist. I work in Laguna Hills in California. My training was at Georgetown University Hospital, which again is near and dear to my heart in Washington, D.C. I'm a movement disorder specialist and also a neuro rehab doctor. And so today we're going to be talking about sleep and fatigue. Many people, actually every single person that walks into my office wants to talk about this, so let's talk about it today. First and foremost, let's talk about sleep, because I think that's really important, because if we're not understanding sleep and how you're sleeping, it may be the main reason why you're having fatigue. So the first step is ultimately talking about what is sleep and why is it important and what we believe is the theories of why we sleep. So there's 5 stages of sleep. 4 of them are the deep sleep, 1 through 4, and the second one is something called REM sleep, excuse me. And so ultimately all 5 stages of sleep are extremely important. And we should be having probably about each sleep cycle, 1 through 5 is 1 cycle, and that's about 90 minutes to 120 minutes per cycle. And you should actually be having at least 4 to 5 cycles of this cycles of sleep a day, a night, for restoration and ultimately other reasons, which we'll talk about today. So why do we sleep? Well, there's a lot of theories out there, but the main ones that I would like to speak about today have the most evidence that are true. The first one is restorative. What we restore our brains. And what has been shown is that over time throughout our days, we have a lot of waste products that happen in our brains that ultimately needs to be cleaned out. And so they've shown beautiful studies, and again, someday I would love to show you pictures, but I will be speaking like this today, where they've shown that when you do sleep, your brain actually changes, has a really lots of changes actually. And people used to believe that when you sleep, your whole brain's sleeping as well, but it's actually a very active process when you have sleep. And so when you're sleeping, you have something called the lymphatic system, okay? Like the lymphatic system of your body, you have a lymphatic system of the brain. So what's happening is that you get this nice cleaning up the house of your beautiful brain by sleeping. So what happens is ultimately all your cells have a little bit of shrinkage and allows a little bit of the cerebral spinal fluid to go all throughout your system and clean up areas where you have accumulated waste. One of the 2 main things of some of the molecules that are hanging out there with waste are adenosine and amyloid. And some of you may have heard of beta amyloid, which is ultimately one of the precursors that they believe are a diagnosis from dementias such as Alzheimer's. If you have too much beta amyloid, you can have more of a dementia-like state. And so that said, if you can clean that out on a regular basis by sleeping well, you may be having a better opportunity to feel nice, cognitively intact for the rest of your life. So again, sleep is extremely important. The next step I want to talk to you about in regard to sleep is understanding that when you sleep, what else is happening to your body. And so if you don't sleep, and again, some of you may have experienced this, is that things changes in the body itself, such as sometimes your sugars can get higher, and it's ultimately, they say that sometimes it's a precursor to diabetes because there's stress related when you don't sleep, and ultimately their sugars can go nice and high. Cortisol levels are higher, which is your stress hormone, which also can cause you to have a little bit of difficulty time just dealing with life and mood and everything else. Also, some have shown that actually if you don't sleep on a regular basis, you can have more possibilities of obesity and weight gain. Cognitive ability, again, feeling nice and sharp. Again, if you're not taking care of yourself in that regard and it's harder for you to sleep, you may feel like you're a little bit off during the day, and just simply because you haven't had a nice sleep to be able to feel better. And so those are some of the things I wanted to tell you in regard to what can happen if we don't take care of us. So what are some sleep dysfunctions that you may have? And so the main ones with Parkinson's disease, and again, I can't help but I have to talk about obstructive sleep apnea with sleep, just simply because a lot of people don't realize they have this. And ultimately it can be if you're snoring or if you're having literally stopping breathing for even a short period of time throughout the night can cause you to have, 1, very, very tired mornings, and 2, not so good cognitive ability or memories and thought processes throughout the day. So if your bed partner, or if you notice that you're actually having a pretty significant decrease of abilities to remember things, and you're very, very tired, and your wife says, hey, you know what, I hear you, or your husband, excuse me, feeling like you're snoring a lot, I would definitely evaluate that as one of the #1 things that people have sleep dysfunction for. The second one is restless leg syndrome. Restless leg syndrome is actually extremely common in Parkinson's disease. What is it? It's ultimately when your legs feel like they need to move. They're very restless inside. Some people can even have tingling and numbness with that experience. And as soon as you get up, you start to feel better. So you tend to actually get up a lot throughout the night, just simply to be able to feel the relief from the restlessness. And the biggest thing about restless leg syndrome that you need to be evaluated for is iron deficiency. So if you have a restless leg syndrome, I would definitely ask your doctor to check your iron levels, because sometimes that's the main culprit. And if you can fix that, you don't have restless leg anymore. But if you don't and you still have it, ultimately it usually is a dopamine deficiency. So you tend to give yourself either some dopamine agonists such as a Pramipexole or Requip or a Nupro patch, and it actually helps quite a bit. Some people need different types such as gabapentin or Horizont or Lyrica. But those are some of the medications that you can use to actually calm down those restlessness of those legs, because again, it can cause you to have sleep dysfunction. The last one, which I believe there was Lunch with the Docs with a whole series of understanding of REM behavior disorder, but I'm going to tell you just a little bit about it just in case you missed that segment. REM behavior is this. So rapid eye movement. That's when you're dreaming. So your body should be paralyzed in your dreams. It's ultimately a protective mechanism that our bodies do for us and our brains do for us, so that you don't act out in your dreams or talk in your sleep, and you don't hurt yourself or your bed partner. And so ultimately, sometimes you may never know that you actually have this, but your bed partner will say, yes, he talks all the time, he's jumping out of bed. And I've had some people actually hurt themselves quite a bit from just acting out in their dreams and not even knowing that they're doing this on a regular basis. So if that is the case, which is extremely, extremely common with Parkinson's disease, again, the 3 cardinal symptoms of non-motor symptoms you can have 10 years before you ever have a diagnosis of Parkinson's are lack of smell or decreased smell, constipation, and the third one, which is very, very, very prominent, is REM behavior, sleep dysfunction. So how do you treat it? First of all, some people actually get a sleep study, and some people don't. Ultimately, all you have to do is a clinical diagnosis of, hey, I have this is what's happening to me. Imagine if you have 5 stages of sleep, and of those 5 stages of sleep, you're going through REM once every cycle. And so you're ultimately having quite a bit of REM behavior because you're dreaming a lot. And so if that happens, sometimes they have believed that you have a lower level of melatonin in your body. And dopamine is ultimately the precursor for melatonin to work well for you. And so sometimes you have to supplement with melatonin. If not, if that doesn't work for you, the other gold standard is clonazepam or Klonopin. And depending on the dose of what you can tolerate, again, those are the 2 medications you would do to help you with that. So if you feel, yeah, I feel like I'm sleeping really well, and I don't think any of those things are an issue for me, the next step I would have is ultimately looking at medications that you're taking. So fatigue can happen with a lot of different reasons. Again, one of the main ones is sleep dysfunction, not sleeping deep enough, or changing the way your body is sleeping, your sleep patterns. Let's talk about sleep hygiene first before we go into talking about medications. So sleep hygiene is a funny word, but what it means is, how are you sleeping? What are you doing for yourself before and during and after you sleep? And so ultimately, it's really important that you set yourself up for success. The first thing is this. 1, you want to make sure that if you're going to drink water, which you need to be hydrated, I always say water, 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 water is so important for your body and your brain. But if you're getting up to urinate a lot throughout the night, that may be one of the reasons why you're not getting a good restorative sleep. And so if you decrease the amount of water you're drinking 2 hours before you go to bed, you may have a better night's sleep. The second is ultimately having not too much food in the night. The dinner that you eat, maybe a little bit smaller of a portion than you do during the breakfast or the lunch, simply because your body ruminates, literally breaking down those foods and making sure that you have all the nutrients you need. But sometimes that actually messes with your sleep cycles a little bit. So you may want to consider just decreasing the amount of food portion 2 hours before you go to bed to eliminate that possibility. The third is you really want to make sure you don't have any clocks in your room. And if you do, you need to turn them upside down and just say to yourself, I'm not going to look at this clock and figure out what time and how much more time I have until I have to wake up in the morning. Because guess what you're doing? You're waking yourself up to calculate. You're turning on all these receptors in your brain, and ultimately it's much harder to fall back asleep. The fourth is thoughtfulness in regard to what your sanctuary of your house looks like, the sanctuary of your bedroom. That should only be for sleep and sex only, okay? So ultimately what you do is you walk into that room and say, do I have a lot of things that are stimulating me to a point where I'm not sleeping well? Whether it be ambient light, too much light in the room, or whether it be that your bed is not comfortable enough and your pillow's not comfortable enough. What type of light exposure you have right before you go to bed. You really don't want to try, if you can, not have cell phones or TVs or iPads or computers on and awaken all those receptors up for your circadian rhythms 1 hour before you go to bed. Because if that happens, ultimately your body thinks that you're awake. I mean, Thomas Edison did a beautiful thing, having us have wonderful light, but ultimately it's not a natural cause of how we know when we should be sleeping and when we should be awake, just because we used to follow the day-night cycles, and now we don't have that ability because we have so much ambient light. So that's a thought process as well. So those are some of the sleep hygiene things I would speak about. So ultimately, if you can get all those under wraps and you're still having difficulty, then you need to talk to your neurologist and see what we can do going forward. So next, fatigue. Fatigue can be, again, from sleep, but it also can be from other things. What's going on in your life? How is your body doing? Are you having more tremor? Are you having more stiffness? Are you having more slowness? Stiffness and tremor are two main reasons why people have fatigue with Parkinson's, because imagine your body is moving all day long. And if that is the case, you're like running a marathon all day long. So controlling the best we can, the tremor, the stiffness throughout the day may allow you to actually have a little bit more energy throughout the day. Medications. There's a lot of medications out there. That's why you should have your doctor look at your medications, because some of them can be causing you to have fatigue. And even if you just change the timing of them, if possible, you can actually get a better night's sleep, because these medications make you sleepy. And just change it up a little bit and find a way to actually, with your doctor's permission, of course, you guys are a team, to help yourself through this and ultimately get an evaluation of your medication, make sure everything's okay in that regard. Next thing, if you do all these things right and everything's going well and you're still having considerable fatigue, you may want to consider, and again, you have to talk to your doctor about this and make sure that everything is good in regard to your heart and everything else, to actually make sure that you can tolerate these. Some people actually do stimulants. Stimulants throughout the day, usually before around 2 p.m., you can take either a Ritalin, an Adderall, a Provigil, a Nuvigil. All these medications are actually stimulants, and you may have heard them in the past, for Ritalin and Adderall, especially for active children, hyperactive children. It's not used for that for us. It would be used more for somebody that has Parkinson's disease or Parkinsonism that can't seem to stay awake throughout the day. And what it does is it actually kind of pushes you a little bit more into a different type of sleep cycle. So you're not sleeping and taking a lot of naps throughout the day because you're so tired, and then ultimately you're wide awake during the night. And so that's also very important to think about, because if you're sleeping during the day and you're sleeping a lot during the day, you're not going to have that nice ability to fall asleep. And so if you have to have a siesta, which is absolutely fine, every other country does it, consider just doing one only a 45-minute cycle, because again, that will get you into the first cycle only, because you know that you actually got that cycle. If you go to the next cycle, you actually may have a difficult time feeling awake for the rest of the day. So those are thoughts that I have in regard to sleep dysfunction and also fatigue, and ultimately improving your daily lives through actually building on being more awake during the day and sleeping at night and actually having a good night's sleep. So again, now I'd love some questions if I could.
Absolutely. If you all have some questions, all you need to do is, I just opened the chat, and you can type them here and I will read them. And if you have private questions, ones you don't want everybody to read, you are welcome to just, under the 2, you just select, you can select my name, Sarah Jones, and I will read them to Dr. Bixby. Quick question for you. You talked about melatonin. Can you talk about extended release versus the just regular melatonin, and how much people should be taking of that?
Sure. So melatonin, extended release, and the They're pretty similar to each other based on how they work. Some people feel like the extended release allows them to sleep longer, and so it really depends on the individual person. I tend to just do immediate release, and ultimately the highest that you should go with that medication is 15 milligrams. And so I tend, again, I'm not trying to plug for Trader Joe's, but I tend to like Trader Joe's because, for one, there's only one there. There's not like 12 that you're going to CVS and you're like, which one do I get? And the second thing, it's chewable, so it tastes like peppermint, and it's very inexpensive. Like I think you get 60 tablets for $3, and it's very effective. And I know what you're getting, and so there's not a whole lot of fillers in it and everything else. And again, I'm not saying that the other types of brands are better or worse. It's just that I know what you're getting, and so I know at the threshold of 15 milligrams is usually just the max that you can take.
Okay, and I believe somebody wants you to spell melatonin, but if I don't have that question right, please let me know.
So melatonin is spelled MELATONIN, and it's a natural product that your brain already makes to allow you to sleep deep.
Excellent, wonderful. Question about, you mentioned something about 45-minute naps. Can you repeat that?
Sure. So sleeping, you want to make sure that you're not having too many naps throughout the day. And again, there's a threshold usually, and this is, again, research that has been over the last couple of years looking at sleep cycles. So there's a 45 minutes, really truly it goes 45 minutes to an hour and 20 minutes of a portion of time that allows you to have a good sleep cycle. And so again, 45 minutes to an hour and 20 minutes is where you kind of want to hang out to allow you to have a good nap without going into another sleep cycle, and allow you to go into a too deep a night's sleep and not feel a little grumpy when you're waking up. So the goal is to actually get one sleep cycle down, but not try to go into the next one. You do your best, but ultimately if you do the 45 minutes to an hour and 20, you should be safe enough to actually feel good. And again, this comes individually. You can start practicing and going, okay, I'm going to set my alarm for 45 minutes. How do I feel when I wake up? Do I feel like I was dreaming and I woke myself up? Or do I feel pretty good when I wake up and I'm ready for the next moment of day? Or does it feel like about an hour is really my true sweet spot? It just depends on the person, but usually it's around between 45 minutes to an hour and 20 for a good sleep cycle without making you tired throughout the day.
Interesting. So is that why, you fall asleep and then, you wake up at 5 a.m. and you're awake for a half an hour and you have one more hour to sleep or an hour and a half to sleep, and you go back to sleep and you wake up and you're so tired.
Exactly. That's exactly. You're in a place where you're actually waking yourself up when you're going deep enough that you're like, that's not a good time to do it. If you ever get a chance, you can go on any type of Google and look at the 5 stages of sleep. It gives you those ideas of where you are in your sleep cycle when you wake up, if you're like kind of not feeling off, or you're doing this or feeling like that, or I had some dreams. And it tells you actually what you should be experiencing depending on what time you wake, where your sleep cycle sat when you woke up. And so it's pretty interesting. I love sleep.
Interesting. Okay, questions for you. You mentioned 2 medications to help you sleep. Melatonin was one, and there was a second one.
Yes. The second one is clonazepam. Okay, this is for, again, I want to reiterate, this is for REM sleep behavior disorder, okay? Acting out in your dreams, talking in your sleep. These are the 2 FDA approved standardized treatments for REM behavior, okay? Insomnia is different, okay? Again, melatonin is great. I always start with melatonin first. The second thing I also talk about is considering getting a light box. I know this sounds odd, but if you can change yourself where you have more light during the day, that keeps that circadian rhythm in a really good place that you're in the daylight, because sometimes we're in different ambient lights and it doesn't really trigger that. So if you have more exposure to light during the day, you're going to be more sleepy when the light gets a little bit dimmer through the night. That's another way to treat this. That's not medication. You can get a light box at Amazon.com, and it actually works for something called seasonal affective disorder, SAD. Yeah, so that's, again, I trained in DC, and I had about a very fair number of people that had depression that had seasonal affective disorder because of their light evaluation, not getting enough light throughout the day, cause them to have this type of depression. So they'd have a light box and it'd make a huge difference in the way they feel through the day. You can do that for insomnia as well. There's the Ambiens out there. There's the Lunestas out there. There's the Restorals out there. There's all these medications that are out there for insomnia. It's just most of them cannot be used on a chronic basis. It just you don't do well with them. A lot of people can notice a little bit more of cognitive decline if they use them too long, and those are statistically significant studies. So I'm really careful about what I do with treatment of insomnia. I'm perfectly fine trying short term, but I also believe that when it comes to insomnia, you have to see what else is happening. Is there something else in your life that you can be able to tweak a little bit to allow you to have a better night's sleep? And those are the things we talked about earlier.
Are any of those other medications used, like Ambien, those kind of medications, are any of those contraindicated or not a good idea for a person with Parkinson's to use?
So using those medications are, again, an individual basis. So if anybody has any degree of cognitive difficulties, you really don't want to go to that realm because it can actually make it worse. There's not an actual contraindication for those medications, but it's ultimately used with caution is what they say, especially over 65 period, no matter what you have. And so that idea is that's why I have to be so careful about this, and ultimately using a natural product like melatonin, or some people use sleepy time tea, which works beautifully for them. Again, that's a tea that has chamomile and all these beautiful licorice and things like that actually are natural products that are very safe. So ultimately, I always try to do more natural if I can, and also get to the bottom of why you're tired, and then maybe actually help that process before you start the Ambiens and the Lunestas and the other things of the world, so.
Okay. Now, there's a question regarding restless leg syndrome. You mentioned a patch for dopamine deficiency. Can you talk again about that?
Sure.
And you talked about the one medication for REM disorder. Is there anything else that people should know about?
Okay, so in regard to, let's start with a patch first in regard to restless leg syndrome. So that patch is called Nupro patch, and that is a very low milligram of a dopamine agonist. So let me explain a dopamine agonist again. So dopamine agonists look like dopamine. And so you may already have that on board for Parkinson's disease to help you feel good. But some people only use the dopamine agonist at night, whether it be the Nupro patch or the Requip or Repinerol or the Mirapex or Pramipexole, to actually just curtail the ability to have those legs relax a little bit. Okay, so there's a lot of other medications that are helpful as well that have been FDA approved, such as Lyrica, Neurontin or gabapentin. Horizont is also another brand that actually works quite well. It just depends on you. And again, everything is individual and nobody has a perfect solution for them. It may be something completely different for you. And so that's that answer. The second one, in regard to REM behavior, I think we may have touched on it again. Melatonin and clonazepam are the two that actually help with REM behavior. Clonazepam, Clonazepam, or Klonopin, which is ultimately the brand name, are also helpful. Again, smaller doses because that is a benzodiazepine, which again is used such as the same type of as Ativan or Xanax. You may have heard of those a little bit more than the clonazepam. The reason why the clonazepam works well is because it's long acting, and so there's less ability to have a sensitivity or an addiction quality to it. Again, it's still, you have to be thoughtful about what you use and what you choose per individual.
Okay. Question about blue light and the impact of blue light on sleep.
Okay, great. Blue light is fantastic. So ultimately there's different lights. There's white lights, blue lights. And so people have a certain amount of receptors in their eyes that ultimately some people get a little bit more overstimulated with blue light compared to white light, depending on you. Okay, so I have people that actually have certain glasses that block that light because it's just too stimulating for them, whether they have migraines or they have just really bad photosensitivity. And also people that actually are gamers, they use certain type of glasses so they actually can be online for 1,000,000 hours. And so depending on how your body is tolerating it, again, that could be another way of treating it.
Okay. How about this question? Should partners wake a person with Parkinson's who's having a bad dream?
That's a great question. So there are two theories on that. So ultimately, if they're going to be a harm to themselves because they're acting out in that dream, I would wake them up because I want to keep them safe. Again, we got to treat it. I talk to your doctor about it because it's ultimately something that may happen in the future, kind of protect them. If they're acting out in their dreams and they're having a bad dream, and you want to make sure you protect yourself as well, because again, they can still stay in that dream, what do? It's a situation specific thing. And so ultimately, if you feel like they're going to fall out of bed or they're going to hurt you, you want to wake them up, but you may not want to be close to them when you do that, because if you're shaking them and they act out in their dream, they could hurt you. So you have to be thoughtful about that. Again, if they're talking, they're sleeping, they're just really, really having you could tell they're in a lot of anguish. Absolutely, but ultimately you're not going to remember it. Most of the time you don't remember your dream when you get woken up, or maybe just a little smidgen of it. And so just so you're aware that ultimately it's subconsciously going through a dream-like state. And if you don't wake them up, are they going to be scarred from it? Less likely, but again, it just depends. I have patients that have had a lot of vivid dreams from the military and the things that they experienced, and they ultimately get treated well. And again, that's not a totally different topic, but the idea is how much can somebody's subconscious take? And it's hard to say what that is, but ultimately you just have to have a gut feeling. This is not going well, and that's when you wake them up. Okay.
Question here. My husband gets up 3 to 4 times a night to use the bathroom. Is there anything I can do to help reduce this? It really impacts my sleep. So this is from a care partner.
Sure, absolutely. So one of the most important things first I have to talk about when it comes to nocturia or nighttime urination, is you have to ask yourself, is this happening all throughout the day, or is it only happening at night? And if it's happening only at night, and again, of course, you need to get a urology evaluation, make sure the prostate's good. If it's a male, make sure that everything's good in regard to the bladder, pelvic floor, strength, and everything else. But if it is a Parkinson's thing, it can very likely be. So ultimately, imagine you go to sleep and you take your medication, your dopamine, okay, and you may not take any more until the next day. And if that's the case, imagine that your bladder, again, because it's a muscle. So it's a nice, happy muscle, okay? But if it's stiff, just like any other body part that gets stiff and has increased tone because of Parkinson's, the muscle of the bladder also can get very tight because you're not taking medication. So what's happening is that bladder is getting tighter and tighter and tighter, which basically decreases the surface area of how much that fluid or that urine can sit. And so if it's enough to actually cause you to go, hey, I have to go to the bathroom with those receptors down there for your sphincter, you're going to be woken up over and over and over again. And you may run to the bathroom and feel like, oh my gosh, I'm going to go to the bathroom so much. And you just may go a little tiny little bit, because ultimately the bladder wall can't hold anymore that much. And so what I usually suggest, again, you have to talk to your doctor. Everything I'm giving you, please recommend is just recommendations. You need to talk to your doctor. Is give yourself something, give you a carbidopa or a dopamine agonist or a replacement the moment you wake up the first time. And guess what? Probably about 70% of people get a very significant improvement of nocturia or nighttime urination frequency, because you're actually calming that bladder wall and allowing it to be open more and allowing to fill in the normal natural urine that you normally do when you wake up and you go in the first thing in the morning. You have a very nice urination in the morning. That's what we're trying to get back to. And so that's a very possible thing that may be happening to your husband or your wife.
Wow. I have to say, I mean, every time I listen to a talk with a movement disorder physician, I am blown away. There is always something new to learn about Parkinson's and about ways to just make life better. And I really, really appreciate that about how you share information.
Oh, absolutely. Thank you.
Fantastic. So there's a question about Ritalin and Adderall. Are they commonly used as daytime stimulants, and what effect do they have on the Parkinson's person with Parkinson's?
Great question. So I use them pretty regularly, depending on the patient, of course. They're very effective for the right person. Again, I can't say that absolutely everybody has had an incredible improvement with Ritalin or Adderall, but it's actually used pretty commonly in the movement disorder specialist realm, where we use them for daytime sleepiness. simply because of the fact that if we can get the change in them and their cycles are different in regard to sleep, I tend to give them Ritalin in the morning or Adderall in the morning, and I start that out very low dose. But you have a little bit of room there to move. And some people actually take it twice a day. What I ask them to do is please don't take it after 2 p.m. Just simply because you don't want to be so stimulated in the evening where you're not able to fall asleep. And so ultimately the goal is to get you a nice, happy, awake state during the day so you get a better night's sleep at night and also have a good day. And so I think they're fantastic for the right person. It just depends on literally just kind of watching over time. And again, side effects, ultimately you have to think that it can cause confusion. I don't have that very much because usually you select the right person that doesn't have confusion in the first place. But ultimately you just have to watch that, and I make sure that caregivers and everybody else is aware as well that this is something you have to watch for. But usually if you do a low enough dose, you tend to not see that.
Okay. You talked a little about REM sleep disorder. I wonder if you could just explain it a little bit more to people, a little more in detail. And then also, a person says they act out their dreams now. Would it be best to see a sleep doctor or their movement disorder doctor?
Great question. And so REM behavior, rapid eye movement behavior dysfunction, that's the cycle of sleep that you dream. And so when you see your partner and they're moving their eyes back and forth horizontally, you know they're dreaming. And so that's how you know you're in that sleep cycle. How and why does this happen when you actually have a deep sleep in your dreaming and you start to have this gateway where you're no longer paralyzed in your dreams and you're able to talk in your sleep and also move? That ultimately happens because you have a dopamine deficiency. So the lower the amount of dopamine, the more gateway possibilities you have because it's protecting you usually. Dopamine usually protects you. So again, I talked about treatment of REM behavior. Ultimately, you can also try some dopamine and see if that helps at the end of the night. A controlled release carbidopa-levodopa, maybe a 50/200 may help you, and you may not need the other melatonin or clonazepam. But the goal is this, is that to be able to first diagnose it, because some people can have just periodic limb movements of sleep that's not acting out in your dreams because you're not dreaming, you're in a different state. That happens in stage 2 or 3. But if it's ultimately, you can tell they're fighting or they're doing something or there's an action related to it, ultimately, usually it is a REM behavior. And so you're just basically trying to get you back into a place where you're no longer able to move or talk because that's not the natural state of dreamlike state. And so that's the goal of giving you either melatonin or adding more dopamine or giving you clonazepam so you get a deeper night's sleep. Imagine if you're acting out in your dreams all the time, you're also running a marathon because you're ultimately, that should be a restorative sleep, and you're ultimately using more and more and more energy and ultimately not getting that great sleep because of the fact you're acting out in your dreams. I hope that answered the question.
Yeah, that's great. Can you explain how much sleep you should get in each phase of sleep?
Yes, so each phase, so there's cycles. So everybody's different in regard to how much you stay in each cycle of that sleep. You have 5 stages, 5 cycles. Stage 1, 2, 3, 4, and then REM behavior, REM is 5. And so usually you stay in that dream, that one cycle for 45 minutes to an hour and 20. And it really just depends on your fingerprint, like who you are and what your body does. And so there's no way of actually pinpointing exactly how much time you're in that one cycle. But once you reach that whole cycle, then you go to the next cycle. And that's restorative, doing all 5 cycles. And so ultimately, again, it just depends. 45 minutes to an hour, 20 minutes is one cycle. And you should probably usually have between 4 and 5 cycles per night's sleep.
Okay, great. What does a sleep study do?
Oh, great question. And I didn't answer the rest of that question. So if you have Parkinson's disease, I know they asked if they should see a sleep doctor or they should see a movement disorder doctor. It just depends. If you only have acting out in your dreams and you don't have any other symptoms of Parkinson's, you need to see a sleep doctor so they actually can evaluate you, because there is a sleep study evaluation to look at your electrical activity of the brain to see that you actually are having that. And again, some people have that with Parkinson's as well, but usually that's a clinical diagnosis and we treat it without having a sleep study done, excuse me. And so I just want to make sure I answer that question. So the next question was, what does a sleep study show? So many things. And so ultimately what it shows is how your sleep cycles are going and making sure you're getting all the cycles that you need. The other thing it looks at is if you have sleep apnea. So for instance, some of my family members have sleep apnea. What happens to you is that you get to a point, and again, they think it's either an anatomical thing where you're a little bit bigger of a person and your tongue falls back when you're sleeping, decreasing your airway ability, and so you decrease the oxygen to the brain, and then it wakes you up. And you can do that sometimes 45 to 100 times a second, a minute, and it's incredible. Like wake up, and you don't realize you're having that. So imagine waking up like 45 times in a minute. You're barely sleeping. And so some people can have mild to severe sleep apnea. Apnea means decreased oxygen while you're sleeping. And so that's an evaluation for a sleep study, which is very, very, very important for you to do. Other things, again, you can evaluate how your sleep cycles, do you ever get deep enough to have a REM sleep. Other things you look at for our periodic limb movements of sleep, it's called PLEM. And it looks at is your legs moving at a certain point, and it gives you an opportunity to know that that's happening to you so you can actually try to treat it. And so sleep studies are great because it gives you a lot of information and also discounts and says, okay, you don't have this, you don't have this, you don't have this, let's look at something else. So I think sleep studies are very important for the right person.
Okay. And how about, is marijuana or medical marijuana helpful and safe for people with Parkinson's and sleep?
Great question. I get a lot of that in California. So here we are. Okay, you ready? And so there is two components of marijuana. There is CBD and there's THC. I know there's other things there, but those are the two active ingredients of marijuana. So if you're smoking straight marijuana leaves, you're going to get both of those things. And so ultimately, I'm very careful about the fact that whether you have just the CBD with maybe a little bit of THC, because again, the THC part of it is the hallucinogenic part of that plant. And so now, again, in California, I'm not sure where you are, there's people in dispensaries that actually give you either on the tongue or gummies or these other different types of ways of getting this marijuana derivative that would be most likely safe. Again, I'm saying most likely because, again, we have no clinical trials on it. But using it in my clinic, again, I do not administer the marijuana or the CBD. They go and see an actual doctor that only does this, whether it be an internist or a family practice doctor or whoever decides to do it, and they get a referral there, get evaluated and say, okay, you have Parkinson's, this is the things you're having, let me see if this will help you, and then ultimately the dispensary gives them what they feel like they need. And so that's ultimately a little bit more out of my hands in regard to me actually prescribing it. But what I have found with patients that I feel are good candidates for it is usually when they have stiffness. Some people have noticed that tremor gets a little bit better. Definitely sleep can improve. Again, I'm very, very careful about this because, again, some people have cognitive abilities, changes, short-term memory, confusion, sundowning. I absolutely cannot have those patients try this because simply you can have that ability and actually get much worse. And so it's ultimately, again, I keep on saying this, but it's an individual choice. But some people do very, very well with it. It's just you have to make sure that you're weighing the pros and the cons of it.
And that would be an important discussion then to have with your movement disorder physician so that you're putting that into the whole context of all the different treatments that you're having.
Absolutely. Absolutely. Again, it's so new for us to be able to use this at a medical basis, medical marijuana. And so I would love to have some studies on it. And again, that's something that we definitely need, just simply because I get that question every single time. I do a lot of support groups every single week. And ultimately, I think it's a wonderful, wonderful tool. I just do not have enough information to make sure that you're safe on it for every single individual. So.
Great. Question about coffee. How does coffee impact people with Parkinson's?
Okay, so they did a study when they evaluated some nutritional supplements or things that you would use on a regular basis. And again, this is just one study. I'm sure there's more studies coming out at this point, but they did show that caffeine, or the coca plant that actually makes caffeine, is actually quite good for Parkinson's. It's neuroprotective. Again, that's just one study, so we're still working on that, but I'm not going to ask you to go out and get like 5 shots of espresso, because ultimately that can make your tremor and your sleep dysfunction worse. And so it has been shown to be actually protective. It just depends on how much. And again, I know that's the next question, and I wouldn't be able to answer that question. They have looked at milk as being not the best thing for you with Parkinson's because it is an inflammatory response with that. Again, heavy meats diet is not the best thing for you because you have so many free radical possibilities with that, and also increased inflammation. And so going through and figuring out what works for you, especially in diet, and again, we're going to get there. We're going to figure out exactly, hopefully, as time goes by, a good nutritional PD diet, Parkinson's disease diet, that you can run with for a long period of time in a happy space, because your food is who you are. So I absolutely agree with that. And also exercise is who you are too. So the only things we can control in this world are something what we put in our mouth, what we do to our bodies, and what we can do for our bodies. And so I'm a huge advocate of both of those things. So thank you for asking.
You just mentioned exercise. I'm wondering if there's any recommendations related to exercise and people with Parkinson's and timing of that related to fatigue and sleep.
Okay, great question. In regard to the fatigue and sleep, you want to do it early in the morning. You don't want to do any type of strenuous or even moderate activity 2 hours before you go to bed, simply because you can actually wake up those endorphins and you just can't get to sleep. And that's with every single person, whether it be Parkinson's or non-Parkinson's patients. And so that's very, very important for you to know. Exercise is actually one of the holy grails, I believe, in regard to improving your abilities to do the things you do. I absolutely believe, and again, this is my opinion, that it does slow the progression of the disease, because I've seen so many people, for one, when they start to exercise and move their body, and their body actually responds to it, that they do so well. And then people that haven't worked out for 3 or 4 months, and I see them and I'm like, wow, what has changed? Because things in Parkinson's do not dramatically change like this. It's not the disease. It's what you're doing to your body, because ultimately you can tell such a huge difference when you exercise on a regular basis. And again, the next question would be mild, moderate, or severe, or extraneous, and how much do you work out? One, what can you tolerate? And you can build yourself up over time. I always just do the shaking hands with the patients and say 10 to 15 minutes, give me 10 to 15 minutes a day. And then we slowly build that up over time, because ultimately, if you've never exercised in your life and if somebody's telling you to go do some jump rope over there, it's going to be a lot harder for you. But ultimately, building yourself over time is going to be the key to actually making your life and your Parkinson's be as controlled as possible. So exercise is extremely important. Moderate, mild, strenuous, just continue to move is basically what I want to say. Yeah.
Great. And there's a question of, does it help you as a doctor if I write a sleep journal and bring that with me?
Absolutely. I'm a huge journal fan, okay? When it comes to your symptoms, to understand how your body's responding to your medications, to see if there's anything I can change with you. Again, we're a team, so it's up to you, but we're going to talk about recommendations where what's going on? What are you doing on a regular basis so we can figure out a trigger diary? Like, I slept great for 3 days, but the last 3 days have been horrible. What's different in your life? Are you more stressed? Did you have more caffeine? Did you exercise a certain time? Did you forget to take a melatonin or forget one of your doses? I mean, there's so many things in your life. This is an all-encompassing life. I mean, you're going to be the most healthiest body of a person. You have Parkinson's, but the way you've done everything else, that's the goal in this talk, is to find balance in yourself. And so all the other things are just in check. So yeah, you have this Parkinson's, but everything else seems to be doing very well. So you tend to do well, period, through your life. And so it's great to have diaries and journals to actually understand a little bit more how your medications are working for you. And also, if you have sleep dysfunction, why is it happening? And it's maybe like, oh, you want to know about your sleep? And your partner says, hey, I see you do this all the time. And maybe you never had that discussion before because you never thought to. And then we have this great information gathering that actually helps us kind of figure it out. I think it's great.
Okay, great. Well, I know that we're going to need to tidy up here soon, because we are so appreciative of you sharing your lunch hour with us, and we know that you're going to need to be able to go see more patients. But I do want to mention, so Dr. Bixby is a movement disorder physician, and for those of you who don't know what a movement disorder physician is, we are really strong advocates of making sure that you see a movement disorder physician at least annually, even if you see a general neurologist. Movement disorder physicians are neurologists with advanced training in movement disorders like Parkinson's disease. So they're going to know the most in-depth information about how to pull together your medications, what's right for you, and they just have a depth of knowledge that just is unmatched. And so making sure that you connect with a movement disorder physician is really, really important. Dr. Bixby is on our website, so if you're trying to reach her, you can reach her at www.PMDAlliance.org, and we have a resources list, and you'll see the physicians for California, and Dr. Bixby is on there, and you click on it, and you go right to her website. And we keep a pretty good list on our website, and if there's somebody, if you're living somewhere else, because we know we have people from all over the country that join these talks, if you're living somewhere else and you don't know where to find a movement disorder physician, please feel free to reach out to us and send us an email, and we'll make sure to get you linked up with a movement disorder physician in your area. I don't know if you have any more to add to that, Dr. Bixby, about movement disorder physicians, but it's a passion of ours to make sure that everybody sees one.
I feel the same. Again, there's wonderful, brilliant primary care doctors and wonderful, brilliant neurologists out there in regard to that don't do movement disorders every single day. But the beauty of it is if you just have an opportunity to see one person, maybe once a year, like we talked about, it ultimately just kind of cleans up the list. I have people that come and see me from all over the country just for one visit a year, just to make sure they're doing the right things. And if there's anything new on the horizon, learning about research, because again, this is a very dynamic, amazing time in our life. It's really exciting for me because, again, I would be absolutely fine of not having a job anymore because you don't have Parkinson anymore, because that's my goal and that's my hope. And so ultimately, if you want more information in regard to what they're teaching you and what they can evaluate and what kind of research is out there, and ultimately if there's just a little bit of tweaking of your medications, I think it's important to have at least one day of a year to evaluate with a movement disorder specialist, just to make sure you're on the right track. Yeah.
I agree. It's unmatched. You know, we wouldn't think of it if somebody had cancer. We wouldn't think of not going to an oncologist. Yes. And it's you know, treating yourself right and making sure that you have the absolute best information. Plus, movement disorder doctors know the most current information, the current medications, and also what's coming down the pipeline.
Yeah. Yeah, absolutely. It's super exciting. I mean, I have to tell you, I can't wait. I mean, every day I'm waiting to open up the paper and saying, okay, we got the cure. You know, that's where we're going and that's where we're headed. And so it's exciting to be able to know that. And I want you to know it as soon as possible. So that's the goal. Absolutely.
Yeah. Well, you are an inspiration. Thank you so much for taking your time to be with us today. And for all of you that were able to join us, and we'll let you, the others know that weren't able to join us as well, this will be put on our YouTube channel, and then you'll be able to watch it because it's full of a lot of information. So you'll be able to watch it on the YouTube channel. If you don't receive our e-newsletters, please be sure that you go to our website and sign up for our e-news so that we can be sure to keep you informed. We do these talks every month, the fourth Wednesday of every month, from 12 to 1 Arizona time, which right now is on California time, because Arizona doesn't change. But we will have it every month, the fourth Wednesday of every month. And we have quite a few conferences. We have some coming up here in Arizona. We have one coming up in California next month. So please definitely stay in touch with us and stay engaged. We are on this journey with you. As Dr. Bixby mentioned, it's a partnership. So we are all in this together.
Absolutely. It's an honor to be here. Thank you so much.
Thank you so much. We look forward to having you back on one of these again.
That would be great. I would love to come. Thanks so much.
Okay.
Take care.
Everybody have a great day.
Take care. Thank you.
Bye-bye.
Bye-bye.
Bye-bye.